To describe as simply as I can what radiation therapy is, radiation oncology as a discipline is the use of ionizing radiation to create cell death for cancer cells and try to spare as much of the normal tissue as we possibly can. That's what we do. Patients should really feel very confident picking us for their radiation oncology services for several reasons. I would say the first is that our faculty are very experienced. It's a very senior faculty who are subspecialized and they treat certain diseases and they're really experts in those diseases. I would say secondly, we have a very high volume of patients, and that's a good thing because that means if you need radiation oncology services, particularly for something that's complicated, which is most of what we see, our physicians have seen those patients. And it's not just our physicians, it's our medical physicists, our dosimetrists, our therapists. They have a level of expertise in their diagnoses because their volume, they've seen it before. They've seen it many times before, and they've taken care of it many times before, and they know how to go about that. I would say the third thing is we do operate in the context of the Markey Cancer Center, which is an NCI designated cancer center, the only one in Kentucky. We have great relationships with our medical oncology and our surgical oncology colleagues and our other medical colleagues. And we really approach the treatment of cancer as a team, and generally speaking, that's how you have to approach it to get the best outcomes. It's a culture of inquiry. It's a culture of trying to learn better ways to do things. It's a culture of critical analysis of what you've done before, where you are, and where you need to go to continue to make things better. It's also a culture of continuous education. And while we have learners in our environment, they are very bright and they keep us on our toes. They ask great questions, and we have a responsibility to them to teach the most current approaches and thinking relative to the management of cancer patients with radiation. We take that obligation seriously, and so it's going to ensure, as well as you possibly can, that our physicians are really on the leading edges of how is best to take care of these complicated patients who have cancer.